Hi, everybody. Wanted to give everybody a quick Facebook Live update related to some COVID data. And then I know just touch on a couple things from the governor's briefing. Uh, but it's a mixed bag today. This is really a tough one. Uh, we lost 13 residents in the community. Male 97, 96, 84, 76, 71, and 70. Female 78 and 77. We had 5 nursing home deaths, so just a devastating day related to that. And I'm certainly please keep these families in your thoughts and prayers. As it's tough to try to point out positives, but there are some positives from today overall. Looking at cases, today's a Thursday, Friday high case days. There are high test days. 474. I think that's right where kind of we were yesterday. It looks like tomorrow's a lighter day, but I'll have that confirmed. We'll put out the information tomorrow. Positive news on recoveries, 732. So our active cases has gone down quite a bit over the last 2 days, even with high case days. We now have 3,631 active cases. That number was over 5,000 in the beginning of the week. When we look at the positive news of the day is really about the hospitalizations. It's a lot of the focus, a lot of people's concerns about where's the hospital numbers in the community. Again, we service more than just central New York and Onondaga County. We service parts of the North Country, Southern Tier at times. So where are hospital numbers? We have 249 county residents in the hospital related to COVID. That's down 28 since yesterday. We have 40 of our neighbors in the ICU. That's down 8. We have 15 residents who can get transferred to our COVID transitional unit in partnership with Loretto. And again, I want to thank Loretto. Part of why these numbers are coming down is because of this facility that we've all worked together on. So again, out of the 249, 15 are ready to leave the hospital, freeing up more capacity. So overall, the hospital numbers better today. That's been the trend. We've had a really good week of hospitalizations. Even some of the also very positive news and why we're seeing the pipeline from senior facility to hospitalization to ICU and even worse at times. Our senior facility cases amongst residents, we had 5 out of 13. We had 13 senior facility cases today. So 13 out of 472 is a really good percentage to begin with, but we had 5 senior residents. That is certainly, we're starting to see some consistencies with that. Remember, most of the nursing homes, except for one, have received that first shot, and that remaining nursing home is scheduled, and our assisted living facilities are scheduled. Some have started to see the shots, and there was one that was not scheduled yesterday for my report, and we've been pushing that. So I think that may be scheduled. We'll brief people on that on Monday. So that's some positive news as well. So hospitals, positive. Senior facility cases, positive. Vaccinations, positive. We had over 1,000 individuals vaccinated yesterday. We had 1,260 appointments today. So that's important. I know everybody is excited about the vaccine. Remember, we still have 1A where there's still people that are being registered to get the vaccine. At some point, we'll have to give a second shot to residents residents from 1A as well. The governor highlighted 1B today. 1B may begin at some point next week. We have regulations that the state is putting us on under 1B. We'll talk about that on Monday, and we'll talk about our priorities within the state's priorities as well under 1B as well. So I know everybody's excited as the vaccination starts to expand for who's eligible. Remember, we have the ability to get out lots of vaccine. We're building up that infrastructure. We just don't have lots of vaccine. So it's important that we do this in a way that makes sense, that is equitable, and certainly targets our community's most vulnerable, those who have the worst outcomes when they become COVID positive. So we will talk a lot about this on Monday. Remember, we highlighted yesterday, we have vaccine availability right now, Monday and Tuesday, certain number of doses with pre-registrations. We should get more vaccine in on Tuesday. Depending on how much we get will determine how many doses of vaccine we can administer on Wednesday, Thursday, Friday. So we will give a very descriptive and detailed update on this on Monday. So again, you know, a really sad day, a mixed bag. We've lost so many neighbors to this virus in this pandemic, and it's heartbreaking. At the same time, we keep fighting, and every day we keep fighting, we keep testing, and we find this virus so we can stop the spread. The positive rates are going in the right direction. We keep working. Our first responders are working their tails off in the hospitals, and our hospital capacity is getting better. And in addition to that, now the ultimate punch back is the vaccinations, and we are vaccinating as fast as we can. There will be no supply sitting around. We will get it out. We will vaccinate everything that they give to us, because nobody wants this more to end than our team here. So saying that, please have a safe weekend. Remember, we got to distance. We can't have gatherings. Please be safe with your families. Don't put yourself in situations where lots of folks are coming over, especially people that have been outside your pods. So please, the basics are still part of this process, and that will slow down the spread of this virus as well. So thank you, and